Hello all. Today we will make notes on thyroid disorders, mainly hypothyroidism and hyperthyroidism. So about definition, the hypothyroidism is insufficient production of thyroxine by thyroid gland, and hyperthyroidism overactivity of the thyroid gland causing excessive amounts of free thyroid hormone in the body. Etiology. Etiology for hypothyroidism, it may be due to Hashimoto's thyroiditis, congenital agencies, iodine deficiency, antithyroid drugs, post-surgery and post-irradiation. Post-surgery like hemithyroidectomy or thyroidectomy, post-surgery or post-irradiation for head and neck cancers, postpartum thyroiditis, dyshormonogenesis, and for hyperthyroidism, 60 to 80% due to Graves' disease. Then thyroiditis, toxic MNG, toxic multinodular goiter, drug induced, TSH secreting adenomas, thyroid adenoma, TSH secreting adenomas, hydatidiform mole, struma ovary, and hypothyroidism, there are two subtypes also, congenital, like it's called cretinism, the other one is myxedema. Next about symptoms. Fatigue. For hypothyroidism, fatigue, weight gain, anorexia, constipation, cold intolerance, dry skin, impaired fertility, infertility, menorrhagia, menstrual abnormalities, decreased sweating. For hyperthyroidism, weight loss, increased appetite, irritability and restlessness, palpitation, heat intolerance, tremor, diarrhea, oligomenorrhea. So in hypothyroidism it was menorrhagia, here it is oligomenorrhea, loss of libido, increased sweating. Then about signs hypo and hyper. So signs of hypothyroidism: coarse and brittle hair, pallor, xanthelasma, hoarseness of voice, bradycardia, non-pitting edema, carpal tunnel syndrome, delayed relaxation of deep tendon reflexes. And for hyperthyroidism, tremor, tachycardia, hair thinning, alopecia, goiter, palmar erythema, pretibial myxedema, purdy orange appearance. Then lid lag, eye signs separately we will deal. Eye signs: lid lag, stare, exophthalmos and all. Then investigations. So for both TFT, thyroid antibodies, lipid profile, FBS, PPBS, HB. So these are the investigations done in the primary care. Then next we will look into normal TFT values. TSH normal value is 0.4 to 4.5 million international units per liter. 0.4 to 4.5 million international units per liter. And T3 it is 9 to 25 microgram per deciliter, and T4 it is 4.6 to 12 microgram per deciliter. So T3 it is 9 to 25 microgram per deciliter, and T4 it is 4.6 to 12 microgram per deciliter. And free T3 it is 80 to 20 8 to 20 nanogram per deciliter in adults. And for free T4 it is 0.7 to 1.9 nanogram per deciliter in deciliter. So mainly we have to remember this value TSH 0.4 to 4.5 million international units per liter. And for pregnancy it's little different. For the TSH value in its first trimester it is 0.1 to 2.5 million international units per liter. In normal adult it is 0.4 to 4.5 million international units, and in first trimester it is 0.1 to 2.5 million international units, and second trimester it is 0.2 to 3 million international units per liter, and third trimester it is 0.3 to 3 million international units per liter. So it's easy to remember. It's you can remember, it's like first trimester it is 0.1, second trimester 0.2, third trimester 0.3, and in normal adult it is 0.4 to 4.5. So first trimester it is still 2.5, then second trimester and third trimester 3, and normal adult it is 4.5. And next about the interpretation of lab values. A very short notes on the interpretation of lab values, that is TSH value we will get in TFT, we will get TSH, T3 and T4. So in euthyroid state, then TSH will be normal, T3 will be normal and T4 will be normal. And in primary hyperthyroidism, TSH will be high. TSH will be high and T3 will be low and T4 will be low or normal. Primary hyperthyroidism, TSH will be high and T3 will be low and T4 will be primary hypothyroidism, primary hypothyroidism, TSH will be high, T3 will be low and T4 will be low or normal. And then hyperthyroidism, TSH will be low and T3 will be high and T4 will be high. And next hypothyroidism secondary to pituitary disease, that is central hypothyroidism. Some secondary, that is TSH will be low, T3 will be low and T4 will be low or normal. Okay.